to the ITSM Practice Podcast.
Welcome back to the ITSM Practice Podcast. I'm Luigi Ferri, exploring how enterprise architecture supports managed services in government hospitals. Let's begin with a question. What if the health of our systems was as important as the health of our patients? Imagine this. A child arrives at a public hospital in a urgent need of care. The team is trained, the equipment is ready, but the system holding the patient's medical history is down. Allergies, medications, past procedures are unavailable at the worst possible moment. Situations like this, while hypothetical, reflect the real risk many hospitals still face. When technology is fragmented, ungoverned, or outdated, delays happen. And in healthcare, delays are dangerous. This is where architecture management becomes essential. So, what exactly is enterprise architecture? The enterprise architecture, EI, is a strategic approach that defines how an organization structures its technology, processes, information, and people to support business goals. It's the blueprint that ensures everything works together, from core systems to future innovations. In healthcare, it means making sure that IT doesn't just function, but serves the mission, saving lives, respecting privacy, and adapting to change. In government healthcare systems, whether it's the NHS or public hospitals across Europe, enterprise architecture is not a nice to have. It's a mission-critical foundation. These organizations face strict regulations, financial limits, aging systems, and rising public expectations. Enterprise architecture helps manage this pressure by aligning IT capabilities with the clinical goals, national health policy, and operational needs. Let's explore how enterprise architecture delivers impact by focusing on 5 foundational pillars. Integration and interoperability. Healthcare runs on information. Enterprise architecture ensures that systems like EHRs, labs, finance, and HR platforms are integrated so data flows securely and reliably. It eliminates silos and connects teams around a single version of the truth. Security and compliance. Patient data is sacred. Enterprise architecture embeds security into every layer, from networks to applications, using risk-based policies and compliance frameworks. It protects against breaches, supports audits, and ensures trust. Agility and innovation. Technology evolves. Enterprise architecture provides structured flexibility so hospitals can adopt artificial intelligence, expand telehealth, or modernize legacy platforms without disrupting care. It enables innovation that's fast, safe, and aligned with the strategy. Performance and optimization. Hospitals must deliver more with less. Enterprise architecture introduces automation, streamlines workflows, and improves data accuracy. It helps measure what matters, productivity, outcomes, and satisfaction, and supports continuous improvement. The last pillar, strategic alignment. Most importantly, enterprise architecture ensures that IT investments support long-term goals, better patient care, equitable access, resilience under pressure. It connects daily operations to national health priorities and organizational purpose. Now, If you are part of the IT department of an hospital, here is how to identify potential gaps. Are incidents still handled through email instead of coordinated platforms? Do departments still keep important data in disconnected systems? Are upgrades reactive rather than planned through a roadmap? Are compliance audits stressful instead of predictable? Are service outages too common or barely understood? And the last question, are you always in firefighting mode? If more than two of these apply, it's time to ask whether your organization has a strong architecture management foundation. But, and now the game is becoming more complex. What if you are a managed service provider stepping into this picture? Let's consider the risk when taking over a poorly designed architecture. This is about inherited chaos. A weak architecture can expose managed service providers to serious issues. Security vulnerabilities where outdated frameworks lack critical protections. Operational inefficiencies, making it hard to meet SLAs. Compliance risks, especially in healthcare, where non-compliance can have legal consequences. Higher support costs due to endless firefighting and lack of system visibility. Client dissatisfaction, when expectations clash with unfixable realities. So, before accepting ownership of such environments, managed service providers should take time to assess. Here is what to do before their handover. Perform a full architecture and security assessment. Identify integration gaps, vulnerabilities, and compliance shortfalls. Clarify business goals and constraints. Don't just look at the systems. Listen to the people, to the users. Develop a detailed transition plan. Set expectations for timelines, risks, and milestones. Secure the environment. Put basic protection in place from day one. MFA, access control, monitoring, blah, 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 whatever. Define strong SLAs. Be realistic and align responsibilities clearly. Document everything, from network diagrams to escalation path. Clarity is protection. Without this due diligence, even the best service provider can fail. With it, managed service providers can transform chaos into opportunity, starting with true transparency and a shared commitment to healing the system. Now, let's talk about the short-term benefits of enterprise architecture. Once enterprise architecture is implemented, hospitals see immediate improvements. Fewer manual tasks, faster workflows, more accurate data, clearer roles and responsibilities, reduce operational costs. And when there is a disruption, like a ransomware attack or a critical system failure, enterprise architecture makes response faster, more effective, and less damaging. Hospitals also benefit from predictable spending, with technology investments that are focused, measurable, and connected to performance. In the long run, enterprise architecture does something more powerful. It makes change sustainable. Hospitals can grow, adopt new care models, and respond to emerging threats with confidence. They become resilient, not just reactive. They can measure the value of their technology not just in budgets, but in patient outcomes. Enterprise architecture also fosters a culture of collaboration. It stops being just support and becomes a strategic partner, one that builds trust with clinicians, administrators, and leadership. Let's not forget the human side. Technology is not the goal, it's the enabler. When systems work well, Patients are safer, staff are less stressed, and leaders make better decisions. Enterprise architecture ensures that the technology doesn't stand in the way, but opens the path forward. So I'll close with a few questions. Is your hospital building isolated tools or a shared future? Are your systems helping your staff or slowing them down? Are you choosing technology or designing care delivery? And most importantly, is your IT department leading the change or chasing it? You have been listening to the ITSM Practice Podcast. I'm Luigi Ferri. If today's episode got you thinking about gaps, foundations, or futures, connect with me on LinkedIn. Let's reflect together. Until next time, stay curious and clear the path. Arrivederci.